Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today we are going to evaluate the results of the patient who underwent the hair transplantation surgery in our clinic almost 20 months ago. This is a 38-year-old male with the neurotype type 5 of the hair loss. We always explain to the patient that the neurotype type 5 is mainly the receding of the front hairline, on empty spot or areas or balding spots in the front two temples, front forelock, mid-scalp, and there is an empty spot in the crown area. For this type of patients, on average, you may require the numbers varying between 4,500 up to 6,000 grafts. Of course, number of the grafts may change from patient to patient depending on the size of the open area, the density you want to acquire, patient's expectations, the quality and distribution of the pre-existing hair in these areas. But the main factor that affects the outcome of the surgery, of course, the capacity of the donor area or its ability to give a sufficient number of the grafts. As a general rule, of course, there can be some exceptions. Most of the time for the neurotype, starting from neurotype type 5 and above, most of the time we may require a follow-up surgery to acquire better coverage and the density, but it's optional and depends, as we have talked earlier, depends on the number of the grafts you'll be able to get and the size of the open area. So in this patient, we're able to do the surgery with 4,100 grafts. It's a mega session. Out of this 4,100 grafts, 2,300 of them were using the front side of the head. It means the reconstruction of the front hairline, cover the temples, reinforce the front forelock and front third of the head. And the rest 1,800 were evenly distributed between the mid-scalp and the crown area. In the mid-scalp and the crown area, patient had more or less some good hair. So during the surgery, we used the magnifying surgical loops to do the incision and implantation in between these hairs and trying to preserve the own hair as much as possible because they're important for us. Because after the surgery, we also advise most of our patients the medical treatment with finasteride and minoxidil. I always tell my patients like surgery and the medical treatment, the ideal world will be to use them simultaneously at the same time because it's like playing with a puzzle. With the surgery, we try to cover the open areas as much as possible. It's like you have the hair loss, we fit it in. But if over the time non-transplanted pre-existing hair continue to shed, we may face the new empty spots in between the hair, and the patient may need more surgery. So it's a kind of infinite loop of hair loss surgery, but the donor area is not an endless. So we need to be very conservative. We should be using it at an optimal level, the number of the grafts we acquired. So basically, surgery is needed to cover the open areas and the medical treatment is needed to prevent furthermore loss of your non-transplant hair of the patient and reinforce this area. And as you can see, the patient almost 20 months later, the main priority, the reconstruction of the front hairline, rebuild of the continuity of the front hairline is done. The face is reframed. The main area in the front side is reinforced. There is a good coverage in the mid-scalp and the crown area. Of course, there can be seen some small empty spots, but that's perfectly normal because depending on the patient expectation, every once in a while, the follow-up surgery or like a secondary surgery may be required in some patients. It's up to the request to add more density in the coverage. The patient is happy, we are happy. It's a good example of the optimum usage of the numbers that are not very high but not low as well to acquire the best possible distribution and result at this type of the patients. Thanks for watching, guys. Stay tuned. If you have any questions, you are able to ask them just below in the comments. Take care.